Thank you for taking time to view the BADBIR updates video. I will be giving you a really quick update on the study and recent changes. These are the topics I will cover. A recruitment update, changes to the eligibility criteria, the addition of the HADS questionnaire, information about the biologic therapy section, data entry changes to the adverse event page, how to avoid data queries, and finally follow-ups. A recruitment update, so numbers from the 21st of August 2019, we had a total recruitment to BADBIR of 18,776 patients. Next, moving on to the eligibility criteria. The best place to get up-to-date information about the eligibility to BADBIR is the website. You go on the clinicians section and select eligibility. An important note for patients under the age of 16, so BADBIR can accept the registration onto any systemic treatment for psoriasis in the biologic or small molecule cohort. The paediatric registrations are not bound to the list of the therapies listed on this webpage. For the biologic cohort, we've had a recruitment end to Humira and Stelara. So this list will always add the new drugs that have come on to BADBIR. And then for the small molecule cohort, we've had a pause in recruitment to Otezla. For both the biologic and small molecule patients, there's no minimum PASI or DLQI score required, but we still need scores to be taken within 6 months prior to the patient commencing their treatment, so we have a baseline disease severity measure. The conventional cohort, so the PASIs at the time of the drug started, must be greater than or equal to 10, and the DLQI greater than 10. This does not apply if the patient is switching between conventional therapies. So if they stopped one drug and there was less than a 3-month gap between starting another, they'd be classed as a switcher, and we just need a history of moderate to severe psoriasis for that patient. Both small molecule and conventional patients must be naive to biologic therapy to be eligible for BADBIR. Another thing to note for the biologic cohort is that if a patient's switching from an originator to a biosimilar drug, then they are eligible for BADBIR at this point. So for example, if they're switching from Humira to Amjevita, they'd now be eligible for BADBIR. Next, the addition of the HADS questionnaire. The questionnaires can now be found on the database. When you log in, the questionnaires are in the top of the page. And then the HADS questionnaire has been added to the patient quality of life questionnaire pack. Next, going on to the biologic therapy changes. It's very important to document changes in therapy via the database at follow-up. The drug that the patient is receiving at the time of an adverse event determines which company it's reported to. So even though we've stopped recruitment to these drugs, Stelara and adalimumab, these patients will still be followed up as normal if they're currently in the biologic cohort, but any patients switching from the conventional or small molecule cohort, we will not switch these patients. If you've recruited any patients, if any of the patients have been consented before the 31st of July 2019, you need to add them to the database as soon as possible, as we will have a cut-off date when we no longer accept entry onto the database. So we've had a new function added to the database, so for the Stelara dose dates. So if the patient's continuing Stelara at this follow-up, you can click No Changes, then Edit, So if you don't know the dose dates, but you know that the patient stuck to the standard dosing schedule, you click no, I don't know the dates. Then the patient followed the schedule and the database will suggest dose dates for you. You can add these, and then it also gives you the function to edit these if you do find out the exact date that the patient received these doses. So it's really important that we capture the information if a patient stops an originator drug and goes on to a biosimilar. This can often be due to a trust-led procurement policy. So you need to record this on this page. So if the patient stops Stelara, you'd want to choose financial consideration if they've been switched to a biosimilar due to this trust-led procurement policy. And then save page. And then add new for the new biosimilar that patient started taking. Next, going on to adverse events. So we've changed the way that we collect adverse event descriptions for BADBIR. In order to obtain a more accurate picture of the event, we have split the description into 3 separate boxes: symptoms, diagnosis, and treatment. So if certain details are not available, please state this in the corresponding text box. It's important to note for treatment that if you're adding a systemic treatment in here, this also needs to be added to the concomitant therapy section. Another thing we have quite a few queries on is regarding pregnancies and skin cancers. So these both need to be entered as serious adverse events on the database. So if I just enter one as an example, so I need to enter that it is a serious adverse event and choose the category medically important event. Patient wasn't hospitalised overnight and it has now resolved, and save page. So that's the new adverse event page. Next, moving on to avoiding data queries, you can use the function preview queries. So anything that you've missed out while doing data entry will appear here. So the medical problems, the occupation has been missed. So the patient did complete this. I just missed it at data entry. So I'll add it now. And then if you go back to preview queries, you'll see that query is no longer there. So you shouldn't get any queries generated when the follow-up's out of the edit window. Next, going on to follow-ups. So the dates that the BADBIR database generates here acts as a guide. We would not expect you to arrange the patient's clinic appointments around these dates. If a patient's not attending clinic, you can notify us by the feedback section, which will be this button here. And then we will remove their follow-ups from the overdue list. If there's several follow-ups missed, you can enter all the information in the latest follow-up and then mark the other follow-ups as missed, and this will save you time. Please make follow-ups a priority and keep the amount of overdue follow-ups to a minimum so that adverse event data can be reported in a timely manner. So that's the end of the updates video. Thank you very much for listening. If you have any questions, please call or email. Our contact details are on the website.